This has been a really remarkable visit for me.
For me, it has been a great learning experience.
It's remarkable what they are doing.
Let me say one of a kind.
This is what we want to see at all levels of care.
UNICEF is trying to make an impact on decreasing mortality rates, both for mother and children. So we have a two-pronged approach. One is working in the facilities, trying to improve the quality of care, and then you need to work with communities to ensure they are empowered and then they access this high-quality care.
So this is really one good example where primary health care begins at the community level with empowered communities. So we witnessed a mothers group discussing how to get the husband support to seek antenatal care, to deliver in a health facility. We heard the community saying that now women dying due to childbirth is becoming a rare event. How common childhood illnesses like diarrhea is getting really low because of the high exclusive breastfeeding in this community.
The interaction with the fathers groups was, let me say, one of a kind. It's not very often that we see fathers so engaged in the welfare of their wives, of their children. They actually spend a substantial amount of time on a weekly basis looking at each other and trying to understand problems which their families and children are facing and trying to come to a solution. And as a community, they have actually come forward with a bylaw which states that if you're actually delivering at home, that's a no-go and you may be penalized for that.
All this interaction, it points out the key role that the community has in deciding their own health.
The Nadoli District Hospital has benefited from the support that UNICEF has provided through training quality improvement teams, training them on helping babies breathe, essential care for small babies, kangaroo mother care, and also newborn care equipment like radiant warmers, phototherapy machines. The mortalities reduced remarkably, 80% reduction in mortality from 2019 to 2021. And I think that is outstanding. The Akuse Government Hospital had some support from UNICEF. Quality improvement teams were trained. But just to say that the teams have gone way above what we were expecting them to do. Quality improvement has become part and parcel of their routine work. They are looking at their data and using that to make changes, identify problems, and make improvements. They've even gone ahead to even set up this newborn care unit, and this they are doing on their own without any external funding. And I think this is very remarkable. This is what we want to see in all other facilities, hospitals, health centers, at all levels of care. Children are improving, they are spending shorter time in the hospital, which is really good. And they are going home better, mothers are happy, families are happy.